Good afternoon, Dr. Sachdeva. Let us start the question answer session today. Sorry, last time I was not in town, so I could not take that YouTube session. So, a lot of pending questions. If you still have it, we can start answering the questions. I have it on my mobile. If you have something live, you can always ask me. Yes, good afternoon, Dr. Meera. So there was a typical question again. Yeah, Dr. Meera, good afternoon. There was a typical question for one of the doctors that what do we do when the patient complained that there are fissures, but the fissure is not so much painful. The fissure is not so much painful. Occasionally, sometimes there is pain. Now, this is a very, very important symptom because normally if you see fissure, which is the crack in the continuity of cells, basically has a lot of pain. It's painful. But if the fissures are absolutely painless, then you must think about remedies like one of the very important remedies for painless fissures. You have to think about carbolic acid. Carbolic acid I have found very useful when the fissures are absolutely painless. It's a very, very interesting remedy. It's an acid, it's a carbon, both, and it will give you very good results. It is written in carbolic acid. Basically, it is an antiseptic, it is an irritant, and it is an anesthetic. All the three qualities are present in carbolic acid, so it's a very, very important remedy for painless fissures. And regarding carbolic acid, you must say that whenever carbolic acid patient does exertion, जब भी बहुत मेहनत करता है, exertion करता है, he starts getting abscess. This is a very, very important indication of carbolic acid. That means he has abscess on physical exertion, and carbolic acid patient craves for stimulants and smoking. So this is in short something about carbolic acid. Remember the painlessness of fissures of carbolic acid, very important, because normally I again say the fissures, most of the condition you will find that the fissures are painful, but if it is painless, then you must think about carbolic acid. Of course, there are other remedies also like surprisingly painless fissures. Allosocretin is a very important remedy for painless fissures also. Okay, I hope this something will help you for your practice. So good afternoon, Dr. Arora, Dr. Amit, Dr. Prabhu, Dr. Weber. Hello. Sir, elaborate of sentence of organon, what is removed to be from... what is to be removed from the chronic disease? Let it be everything in organon. Don't remove anything from organon. Let it be as it is. It is basically an untouched book. So don't remove anything. Whatever written is by Hahnemann, just follow that. I can only say that. Walaikum Assalam, Dr. Yasin. So something about Walaikum Assalam, Dr. Hussain. So something about painless fissures I told you. Now a very interesting remedy. You can see allosocretin also is there in for painless fissures. Now in allosocretin, you must have seen a lot of things about the piles and mucus discharge, everything. But remember one thing of allosocretin, that allosocretin patient has disinclination for mental labor. He does not want to work. Doctor, important, allosocretin does not want to do mental labor, and he hates people. This is a very, very important indication of allosocretin, that the person hates the people. He does not like people. That is important for allosocretin. And of course, allosocretin has alternate constipation and diarrhea. Alternate constipation and diarrhea. That is a very, very important indication of allosocretin. And there is a sensation of plug between the coccyx and the symphysis pubis. This you will come to know when you are prescribing allosocretin for a constitutional prescription. Don't only prescribe allosocretin only for that piles and mucus in stools and all. But if you are prescribing in for constitutional remedy, you will have this symptom. There is a plug sensation between the coccyx and the symphysis pubis. So this I have seen in many of cases of allos where I have prescribed for maybe ulcerations or a migraine or anxiety. This symptom of sensation of plug between the coccyx and the symphysis pubis is very, very important. So something about painlessness of fissures, carbolic acid, allosocretina. Of course, phosphorus I think is also there. So Dr. Madan, good afternoon. If the patient says that stool remains too long in the rectum without urge, but something is difficult to control the stools. Yeah. So there is basically a symptom where the patient has no desire to go for stools. You can take that because the patient has no desire to go for stools unless there is a lot of accumulation of stools. And sometimes the accumulation is so much that there is a lot of urging to go for stools. So both the parts are there. If the whole sigmoid colon is filled with stool, the urging will definitely come. But till it is not filled with stools, there is no urging. So both the symptoms can be present in the remedy, and you can always think remedies in this condition like Cilicia, plumbum, tarantula, opium, Nux vomica, Hipacil, Graphitis, chamomile, a lot of remedies. So both conditions are there in this type of patients. Pneumonia, HR scores 23 but cured, but now is cold like direct AC fan impact me with the pain in the lungs, ear, throat and taking aspirosperma. No, if you have got pneumonia and the HRCT score was 23, now you get cold air causes that impact on the lungs and all and throat. Aspidosperma will not work. In this case, you have to think, Dr. Arora, that your constitution has become sensitive. Your constitution has become sensitive now. It is reacting to cold air which was not before. So whenever the body is thrown to challenge, you must understand how does the body react. So in a challenging situation, your body has become hypersensitive to cold. So that sensitivity is hurt. So take that sensitivity part in your case and then prescribe, and then you'll be able to get the remedy. Aspidosperma will not work in your case. The sensitivity part is very important. Urethral strictures, your favorite remedy if problem aggravates at night, sting, burning after urination, restlessness at night, agony and despair from disease urination after. See, I will tell you stricture. Let me tell you, there are no specific remedies for stricture, and whatever symptoms you have written for stricture, that pain, that burning, everything is present in a normal symptom of stricture. So normally what we do, we prescribe nitric acid, we prescribe cantharis, we prescribe clematis, and it does not work because the pain, the burning, the agony is a normal symptom of stricture. Now you have to differentiate how did the patient get stricture. I'll tell you an example. The patient post-corona came to me. He had a corona, his score was very high, took medicines, he had retention of urine, and because of that catheter was put, and now corona is okay, but now the patient is suffering from stricture. What remedy comes to your mind? In this case, I gave that remedy single dose to the patient and the whole symptom of that stricture was cured. Which remedy comes to your mind? Anybody? Which remedy comes to your mind? Simple question. I'll answer the stricture question first. Hello, Dr. Gopi. So, Dr. Yasin, which remedy comes to your mind? A simple case of post-COVID weakness the patient had. He was catheterized at the time of COVID, and after the catheter was removed, after some time he started developing that stricture symptom, that burning, the pain, difficulty in urination. The doctor said it is stricture. But with one dose of homeopathic medicine, everything was taken care of. Which remedy comes to your mind? Anybody? Phosphorus. Anything else? Staph aureus. Very good. Anything else? Clematis. Yes. Anything else? See, this is how you have to understand the mater medica. That is why I am telling you I have been teaching more of clinical mater medica just because of this symptom. Now, phosphorus is also indicated, staph is also indicated, clematis is also indicated. But now, what is the cause? This patient suffered from stricture because or after dilatation. Understand? And whenever the patient has stricture because of dilatation, the first remedy that should come to your mind is magnesium muriaticum. I gave that patient magnesium muriaticum 32 doses in 2 days. In 7 days, all the symptoms were cured. The remedy was magnesium muriaticum. This is how you have to differentiate stricture. Sometimes if you ask me general remedy for stricture, I can tell you cantharis is there, nitric acid is there, pulsatilla is there, clematis is there, petroleum is there. But every remedy has its specific indication and specific cause. For example, If the patient has stricture after gonorrhea, the stricture develops. It's a very common problem, and we are what you call so keen to give medorinum because of stricture, because of impure cohesion, and medorinum will not work in this case. Stricture after gonorrhea, remember my dear friend, the first remedy that you should think about is petroleum. First petroleum, second cantharium, and third sulfur. These are the very, very important remedies after gonorrhea. For example, if the patient comes to you with stricture, dilatation, then again better, dilatation, then again better. In this condition, you have to take stricture when there is spasmodic convulsion, convulsive spasmodic. The remedy is Nux vomica, pulsatilla, cicuta, berberis. So differentiate first the stricture and then prescribe. Otherwise, burning and all is a normal symptom of all stricture cases, and you will sometimes only relieve the burning and the pain, but not the stricture. So this is how you have to understand stricture. फॉर एग्जाम्पल इफ द पेशेंट कम्स टू यू एंड टेल्स यू डॉक्टर साहब मुझे बहुत यूटीआई था, बहुत पेशाब में अंगार होते, आई हैड रिकरेंट यूटीआई, नाउ द यूटीआई इज बेटर बट नाउ आई हैव डिफिकल्टी इन पासिंग यूरिन, विच रेमेडी कम्स टू योर माइंड? विच रेमेडी कम्स टू योर माइंड? हेलो डॉक्टर सार्थक. Remember what the patient came to me, said, Doctor Sahab, I have recurrent urine infection. I have taken a lot of antibiotics and now the infection is okay. But now I am suffering from straining urination, difficult urination. I have to strain to pass the urine. Which remedy comes to your mind? Anybody? This is how you have to differentiate and ask the patient's symptoms. Then you will be able to understand the stricture part. Which remedy comes to your mind? Anybody? Which remedy? I told you stricture after dilatation, magnesium ure. Stricture after gonorrhea, maybe you can take sulfur iodide, you can take, Dr. Yasin says, camphor. Okay, anything else? Medorinum. Okay. But what symptom did you think that is important for me to understand? What symptom did you take for prescription? The patient has only come to you, okay, sir, I had recurrent infection. I took antibiotics. Now I am better. But now since few days, I have difficulty in passing urine. There are no pus cells, but still, it is not the recurrence. It is not the infection that is recurring now. Because of recurrent antibiotics, recurrent infection, now the patient has now started developing the stricture symptoms. This is how you have to interpret the symptom, no? Which remedy comes to your mind? Nux vomica. Okay, anything else? So just imagine something more. Something more. Now the patient says that there are no pus cells, the UTI, there is no reports are normal, but still I am having a problem. So in this case, you have to think that stricture because of inflammation or stricture after inflammation. You know, recurrent inflammation, taking a lot of allopathy medicines, the inflammation has gone and now stricture. So from SORA, the patient is gone to soro-psychotic state. So in this case, Nux vomica will not work. The remedy that I gave to that patient was simple remedy, Rustox. I gave him Rustox 200, 2 doses, 1 dose first day and 1 dose second day, and the symptom of stricture was absolutely better. Assalamu alaikum salam, Dr. Bangi. So did you understand the stricture part? This is important, how to understand stricture. So always define your symptom and then you will understand it better in stricture. Okay. So I think this question is I hope Dr. Yasin, you have understood the meaning of stricture. Now one more question. Homeopathy can help in umbilical granuloma in newborn with silver nitrate treatment or cautery suggested? Yeah, I have not had a case of umbilical granuloma in newborn, but I would suggest to you that if the symptom corresponds, then homeopathy should work in that case, Dr. Ahmed. Tongue burning, pain, red aggravation, cold, fold, emulsion of warm food. Yeah, so if you have a specific symptom of like tongue, there is burning in the tongue, you can think remedies. You can think remedies like, first of all, the first remedy you should think about is lacasis. The second remedy, mercury. Third remedy, camphor. And fourth remedy, sulfur. Addicted drug patient got stricture. Addicted drug means what? Then what should we think? No, if there is basically a problem that the patient is addicted to drugs. But I told you two things. If it is after recurrent inflammation, if the inflammation, good afternoon, Dr. Edlezi, welcome. So if the addicted drug means what? If the patient is taking a lot of narcotics, if the patient is taking a lot of other remedies, and then you have a problem of stricture, then also you can think about Rustox. Of course, in those cases, you can think about LM potency of Rustox in repeated doses. Good afternoon, Dr. Navjot. So one more question: diabetic hypertension, narcotics. So in this case, the important remedy that is I have used in my practice is morphinum in LM potency. Is it diabetic hypertension, obesity, constipation, very difficult to make, but urge is there, needs mechanical help, urgent needs to help, very irritated to speak over the phone. A patient, female, diabetic, hypertension, obesity, constipation, very difficult to make, but urging is there, need mechanical. No, paraffin oil is no. Okay, if you have read, yeah, it's a very nice question, but of course, I would have loved it if I would have had a better whole case. But still, there is one remedy in our Mater and it is said that in that remedy, the constipation is so severe. The constipation is so severe that the patient has used a lot of enema, so much enema that the patient still suffers from constipation. It is written in the books. It's surprisingly, it's written. It's a female only. It is written in the Mater Medica, a woman had taken 10 or 12 enemas daily, often past 4 or 5 weeks without any evacuation, constipation for 15 years standing. Which is the remedy? Anybody? Which is the remedy where the patient has severe constipation, even 10-12 enemas per day, did not go for stools for 4 to 5 weeks, constipation standing for 15 years. A very, very interesting remedy. A very, very interesting remedy. And that remedy is also indicated for diabetes and kidney disease also. So that suits Dr. Madan's case. It is field Tauri works well. No, I have never seen field Tauri working well in case of stricture. So I can't comment on that. So the remedy which I am talking about is not Asteria rubens. It is not opium also. We are so fast in conclusion that opium works, but a beautiful case of hypertension, a beautiful case of diabetes with severe constipation, the patient did not go for stools, very much well. A patient taking enema for 12 to 15 enemas per day does not go for stools for 4 to 5 weeks. A good remedy for diabetes, a good remedy for kidney disorders. Which is that remedy? Anybody can guess? Lag-daflurethrin, yes, a very good answer. Lag-daflurethrin, if you have read Allen's keynote first line, it is written, the successful treatment of diabetes and Bright's disease with skim milk by Dr. Donkin, was the hint to Dr. Swan to potentize and prove this medicine, and every single symptom has been written down and cured the sick individual. That is lag-daflurethrin. So the answer to the question of Dr. Madan is lag-daflurethrin. In Cesium jumbolinum, again a good medicine for diabetes, but if diabetes is associated with skin symptom, itching or reddish miliary eruptions on the chest, then Cesium jumbolinum is indicated. In lag-daflurethrin, I have seen potency 30 works very well to start with. You give lag-lef 30 twice a day for at least 3 days. Wait for 15 days. Does not work. Go for 200 potency. If that also does not work, then start LM potency. But do read lag-daflurethrin from Allen's keynotes. It's a wonderful remedy. Even when opium fails, I have seen, when opium fails, lag-daf works very well. In fact, yes, I'm coming to it. In fact, I'll complete lag-daf first. In fact, lag-daf is written, constipation with ineffectual urging. The faces are very dry and very hard, Stools are large, hard. They are very hard and large, and great straining is required. It is so hard and large that there's laceration of anus, and the patient has painful excoriating cries. That is lag-daflurethrin, a very, very interesting remedy for diabetes and constipation also. So now we get remedies for low blood pressure. Now, if you ask me remedies for low blood pressure, there are a lot of remedies for low blood pressure. But for me, if you ask me, Dr. Sudheva, low blood pressure simple is because of lack of salt in the body. Tell the patient to eat balanced diet, first of all. Second, do check the sodium levels. Most of the time it happens that the sodium level is very low, the patient is very disoriented, and we feel that the BP is low, and we give lot of medicines, like we have medicines like Viscam album. It's a wonderful remedy for low blood pressure. We have remedies like what you call Verbascum, good remedy. We have remedies like Alpha, good remedy for low blood pressure. So there are a lot of other remedies, but I would still suggest that low blood pressure, I have never used these remedies for this. Radium brome with gelsemium works well. Yeah, still I would say low blood pressure, there is no, if the patient is suffering from recurrent low blood pressure, take the whole case and then prescribe the medicine, rather than giving a lot of mother tinctures or potencies which will work temporarily against the patient with low blood pressure. So give a constant medicine. You treat the same way as you treat high blood pressure. In high blood pressure also we have remedies like Raufolfia, we have remedy like Strophanthus, we have remedy, but they only work for some time and then again the pressure starts getting high. So in both the cases, basically you have to treat the patient depending on the constitutional symptom or totality of symptom, rather than prescribing only on the symptom. Like, see, low blood pressure will have symptoms of weakness, heaviness, you can prescribe gelsemium, you can prescribe arsenic, you can prescribe any remedy symptomatically. But it will not work unless you prescribe a constitutional remedy. That's what I have seen in the practice. Yes, I may have missed a lot of questions because... Any other questions? Yeah, I may have missed a lot of questions because it may have scrolled up. Yes. Any other questions? You can always type the questions. Yeah, somebody had asked me questions for adenoids. Adenoids I have taken, I think, lot many of times in cases in before also. But still, adenoid, if you basically don't understand anything, you can think about Calcarea carp, Lycopodium, Sambucus niagara, Naxomica, tuberculum also. And there's one bowel nosode called as psychotic compound of Bacillus. That also works very wonderfully. It was a recent case where I prescribed the patient psychotic compound of Bacillus. It worked very well. So in these type of cases, it works. And if you ask me, if you feel that nothing is working for adenoids, then you can start Calcarea floor in LM potency. It will definitely work because there's obstruction by some node or adenoids and all. It will work very well. Calcarea floor in LM potency. It works very well. Yeah. Anything else? Can we have some more questions? Do go home and study leg deaf again. Stricture of urethra after coitus. Actually, you know what happens? I had cases where the patient comes and tells us that after coitus, sometimes the there is difficulty in passing urine, and there is difficulty in passing urine. He has to strain to pass urine, so that's why he does not want to go for coition. In this case, you have to take that only symptom, like stricture, which is convulsive and spasmodic. In that case, if you take these type of symptoms, convulsive and spasmodic, because it's for a particular time, it again goes back to normal. In this case, I have seen a wonderful remedy works. If you have never read this remedy, please do read this remedy. The remedy is Prunus spinosa. Prunus spinosa, Cicuta virosa, clematis. Very, very interesting remedy that you should read. Prunus spinosa, I am telling you because there are a lot of doctors who have now prescribed Prunus spinosa, but it's a wonderful remedy. It's a wonderful remedy, and if you read Prunus spinosa, it is written cramps in the bladder. And how does the cramps in the bladder come? That is because from the pressure of the flatus. So that there is so much flatus in the abdomen that it causes cramps in the bladder, and the patient has to double. He has to double to pass the urine. This is a very, very interesting indication of Prunus spinosa. And in Prunus spinosa, the stream of the urine is thin like a thread. And you have seen a fork, you have seen a khane ka bolte kata. In Prunus spinosa, it is written in the Mater Medica that the stream is forked. F-O-R-K-E-D. Forked stream. ऐसा urine pass करता है patient. ऐसा. Forked stream urine, and that is a very, very important indication of Prunus spinosa. Remember Prunus spinosa, it is a wonderful remedy. Forked stream, thin stream. And there is a pain in the glans penis on urination. So these 3-4 symptoms are very, very important in prunus spinosa. I hope you understood the symptom. Dr. Weber, I hope you got the prunus spinosa. Okay. Child 10 years got diabetic from 2 months. Okay. From 1 year, there is many fights between the parents in front of him. He used to weep and tell his both parents separation, that done, father is dominating. Now, yes, the child basically, now there's a problem in the family. The child has seen the parents fighting, and that has caused basically a very violent impression on the patient. Violent effect, we can say. So in this case, of course, you can think of remedy like magnesium. All magnesium have this. The child, what is the feeling of the child? That is very important. Does the child feel like an orphanage? He feels there is nobody with him. There's nobody. He cannot talk to anybody. He feels like an orphanage. Then magnesium group comes. When he does not feel anything and the child feels as if what to do, then you can think about remedy like natrum. But the important thing is that how is that the child behaves. What is the reaction of the child? That is so important, because you are treating a case of diabetes and juvenile diabetes. So it's so important to understand the reaction and the feeling of the child, rather than just telling that parents are very dominating and the parents are fighting and the patient got diabetes. Why I'm telling you this? Because when you grow in your practice in 20-25 years, you'll be seeing, you'll be seeing a lot of cases where there are so many fights in the family, so many fights in the parent, but still the child is brilliant, the child has not any problem. So the reaction is so important. So that he wants his parents together is a very normal symptom for any child, because the child relates his parents to his friend's parents. So he feels like, if my friend parents can stay together, why can't they stay together? So this is a very common symptom in case of any child who basically wants his parents together. In this 25 years of practice, I have seen there are some common protocols in life that you have to follow. Those are not symptoms, those are states. And you cannot prescribe on that because the child wants the family together. That's normal. The reaction is so important. So in this case, we have a child who's very precautious. In this case, we have a child who wants everything together, a family-oriented child, a child who basically is precautious. He understands. So everything he has absorbed in it. When you absorb everything in it, the grief becomes silent. There is silent grief. The patient is precautious, because precautious personality only have that silent grief. So you can enter the case by two things, either grief silent or a precautious personality, and then you can see this case in a different viewpoint. First, understand the reaction of child. Okay, I hope you understood what I mean to tell you. Yes, I hope, Dr. Babal, I have answered your question. It's an interesting thing, and a stricture today. Okay. And Dr. Navjot, let me tell you that you can definitely control a juvenile diabetes patient without any allopathy treatment. I am telling you because I have few cases where I have stopped insulin and the patient is only on on homeopathy medicines. It is a woman got high fever with inflammation of bladder after coition, with burning pain and stricture, and has hysterectomy some years ago with sinking bladder. It's a woman. Okay, fine. Got high fever, and so it's as simple as that. You have to take the rubric. You have to take the generalized rubric, Dr. Weber. That is called basically whenever there is coition, and the patient suffers from a symptom because of that. Okay, and stricture has hysterectomy some years ago with sinking bladder. In this case, you have to remember 2-3 remedies, Dr. Weber. Those are very, very important. I can tell you, if you don't understand, only think about these 3-4 remedies. First remedy is Agaricus muscarius. Second remedy is Kali carb. Third remedy is natrum carb. And fourth remedy is calcarea carb. These are the 4 remedies which are very, very important in your type of personalities. For example, I'll tell you something about Agaricus muscarius. Now, I know that a lot of people have read Agaricus muscarius and you have a lot of symptom, but let me tell you something of Agaricus muscarius where you'll be able to prescribe Agaricus with a very fantastic symptom. In Agaricus muscarius, the urine is profuse, colorless and clear and lemon colored. Whenever the patient comes and tell you the urine is like lemon colored, nimbu pani saman urine, then you have to think about Agaricus muscarius first. Second, Agaricus muscarius, the patient will come and tell you the urine is cold. Oh, he'll touch the urine and say the urine is cold. That is also Agaricus muscarius. Third, in Agaricus muscarius, the urine flows slowly or in drops. He'll have urine in drops. And whenever the urine in drops and falls perpendicular, we think about Hipparcel. But think about Agaricus when the urine flows in drops. Has to press for passing urine. That is also Agaricus muscarius. Very, very important indication of Agaricus muscarius I have seen in my practice, and I have never failed when I have got these type of symptoms of Agaricus muscarius. And Agaricus muscarius, sometimes there is mucus from the urethra. So these 4-5 symptoms are so important for Agaricus muscarius. I hope Dr. Weber, you understand that. Okay. Dr. Ahmed says, sir, my sister aged 54 is suffering from tinnitus for years. Kindly guide. Yeah, let me tell you, Dr. Ahmed, tinnitus for me also, what do you call, a very, very irritating conditions. Irritating condition because, in the sense, because it requires lot of deeper sense of understanding the whole case. I cannot tell you the remedy as such because we require the whole case in this complaint. Just a minute, sorry. We require the whole case in this case, but there are a lot of remedies which I have used in the practice when there are a lot of tinnitus. For example, I have seen phosphoric acid, I have seen sanguinuria, sulfur, tuberculinum, china, belladonna, lot of remedies. That depends on the constitution and the totality of the patient. So if you could get the totality, I'll be able to answer it better for you. Okay. Yes, so I think that matches. So in many of cases, there are so many things which match very frequently. One more case basically has come on the WhatsApp, but still we'll see first cases on the YouTube. Can digitalis or ferrum picricum given in neural stricture, please, sir? Yeah, why not? If the symptom corresponds, then nothing like that, nothing like it. But let me tell you that the symptom has to correspond. That is very important. If, for example, now you have told a very, very interesting remedy, digitalis, which basically is a very interesting remedy. And of course, ferrum picricum is also a very interesting remedy. Let me tell you something from ferrum picricum. I hope you must have known this. Ferrum picricum is a very, very interesting remedy for senile hypertrophy of the prostate gland. Very, very interesting remedy. Senile hypertrophy of prostate gland is a very, very important indication of ferrum picricum. There is lot of frequent urination at the night, and there is full feeling, and there is pressure in the rectum. That is important in ferrum picricum. There is pressure filling in the rectum, frequent urination in the night, and senile hypertrophy of prostate. I usually give ferrum picricum 30 2 times a day for 3 days. And that is a very, very important indication of ferrum picricum. It is an important remedy for retention of urine, especially when there is a smarting pain in the neck of the bladder, or the pain is in the penis also. That is ferrum picricum. So this is how you have to understand the remedy in detail. Of course, digitalis basically has to be associated with heart elements like palpitation, and the pumping of the heart is very weak. So that's why basically, apart from stricture, the patient is not able to pass urine properly because there is no force in the urine because of the congestive cardiac failure or the involvement of the heart. That is digitalis. That's why it is a very, very interesting remedy for congestive cardiac failure when there is retention of urine because of that. I hope you understood ferrum picricum and digitalis, Dr. Yasin. So let us go further with few questions more. Yes, anything else? Or don't let me start Mathematical, because once I start Mathematical, it's difficult for me to get out of it. Yes, any other questions? Head pain, left in temple, electric light comes and goes, noises, bells, drum, irritated, obstinate, very hurried in speech. Now, see, pain in the left temple, okay, electric comes and goes, okay, and noises, bells and drums, irritated, obstinate and hurried speech. Now, if it's simple, basically only you have to have that type of pain. You can think about remedies like belladonna. First remedy I would have thought about is belladonna. I think you must have already given belladonna, I think, in these cases. So belladonna is an important remedy. Second, you can think about a very, very interesting remedy. I know you must have used this remedy. That is amyl nitrosum. Amyl nitrosum I have found a very, very interesting indication, especially when there is pain in the temples. That is amyl nitrosum. Pain in the temples, patient is very much hurried. There is noises in the ear, like drums, like bells. That is also amyl nitrosum. So belladonna, amyl nitrosum. Then the third remedy that you should think, of course there are hundreds of remedies, but I'm just telling you what remedies are very, very useful in these cases. Third remedy that comes to my mind for this type of temple pain that you should not forget is sanguinaria. Sanguinea canadensis is a very, very interesting remedy. Of course, it is right-sided remedy, but I have used in a lot of cases of left-sided complaints also, especially when there is pain in the temples. Third. Fourth remedy that you should think about in this case, which is a very, very interesting remedy called as Paris quadrifolia. Paris quadrifolia is also very, very interesting remedy when there is pain in the temples, lot of noise in the temples. The main thing in Paris quadrifolia I have seen in the case where the patient is absolutely thirstless. That is Paris quadrifolia. And in Paris quadrifolia, one thing is there. Whenever the patient is thinking too much, he starts getting headache. And the headache is so severe that the left side becomes totally numb. And that is Paris quadrifolia. One step ahead I would go on Paris quadrifolia, that the scalp is very sensitive even to combing of hairs. That is Paris quadrifolia, because in belladonna also same symptom, no? Hair cutting, elements from hair cutting. In Paris quadrifolia also, the scalp is very sensitive to combing of hairs. That is also important. I hope you have got something about these 4 remedies. Sir, for a patient I gave steps, the next day she got fever, taken allopathic treatment, fever was diagnosed with COVID. Now she developed diabetes after COVID, how to deal? Now see, diabetes, in lot of cases of COVID, basically have developed diabetes because of use of steroids. In this case, there is no shortcut, just ask the whole case to the patient and then prescribe. Urine symptoms of dietalis. What to give? In dietalis, everything is, everything in that remedy is related to heart. I think in one of the seminars, I would have told you something about heart tonic. So, Mathematical wise, if you want to understand dietalis, of course, I can tell you some symptoms of heart, but it is of urine, but what I'll tell you something. Okay, let me see. Now, in heart, in urine symptom dietalis, one thing is very important, that the patient basically suffers from fullness after urination. See, if the patient is suffering from CCF, there is a lot of pooling of blood, and the patient क्या बोलेगा हिंदी में, डॉक्टर साहब पेशाब करने के बाद भी ऐसा लगता है कि मेरा ब्लैडर पूरा फुल है. There is feeling of fullness after urination. A very, very important indication of dietalis. Second thing, in dietalis, urine is difficult and suppressed because of uremia, because of contracted kidneys. That is dietalis. And in dietalis, what do you call? There is continued urging to urination, and the urine only dribbles. That is because of enlarged prostate. And hot urine, like in agaricus, I told you cold urine. In dietalis, hot urine with throbbing at the neck of the bladder. The throbbing is so much that, you know what the patient of dietalis tells you? He tells you as if that there is कोई straw कोई आगे पीछे urethra पे कर रहा है. There is a straw being thrust back and forth in urethra. Those are the urinary symptoms, 3-4 symptoms that I can remember of dietalis, whatever my knowledge of Mathematica goes. Thanks. My grandmother, 87 years of old, suffering from dyspnea, CT angio, echo normal, all blood tests report. What should I do? A grandmother having 87 years, only dyspnea, old age. You can think of some remedies of old ages like ammonium carb, or conium maculatum. There are some remedies for old age. Take some symptoms of your grandmother who are, okay, Dr. Meera, take some symptoms of your grandmother, like some what you call some symptoms of grandmother old related to very very close symptom of your grandmother, and then you can prescribe, like we have remedies like conium, we have remedies like brata, we have remedies like ammonium carb, we have remedies like lachesis, lycopodium. These 5 remedies basically are remedies for old ages. Just take few symptom, one or two important symptom and prescribe. The only thing which we want is only to just palliate the complaint, because the quality of life has to improve. So these 3-4 remedies, club one or two symptom and prescribe. Sudden sinking after dinner. Think about phosphorus. Sir, do you prefer dry dose or water dose or LM potency? Actually, depends on the case. You do hear the LM potency lecture of my I think YouTube, which I taken Hahnemann Jayanti, and you will understand when to use LM potency. Basically, in 6th edition of Organon, Dr. Hahnemann has told that whatever I have written before this basically has to be not seen. Now I have written a new potency, LM potency. So if you are following 6th edition of Organon, LM potency has to be used. If you're not following that 6th edition, then C potency also can be thought of. When you require a lot of repetition, then you can think about LM potency. Dr. Ahmed says, sir, a little cat dull and little move, no appetite. Little milk takes. Cat dull. Little moves, no appetite. Okay. So in this case, a little cat, what should I tell you? In this case, I know you have to just stimulate the appetite of the cat. Just see how is the cat. If the cat is very dull and all, think of remedies like acids, like arsenic is there, second gelsemium is there, and third, I've seen a very important indication, that is butyric acid. Okay, it's already 45 minutes. I'll take few questions more before I. Like for Dr. Meera, if you have old age complaints of bronchitis, think of ammonium carb hypericism. Old age patients having bronchitis, hypoxia is indicated. Old age complaints of weakness, nux mosquito is a very important remedy. So the old age basically have to get to that remedy and get to that group of remedy and prescribe. Anything else? So one more case, sorry, on WhatsApp, just a minute, huh? I've just forgot it. Remedy for micropenis in there's a question on WhatsApp, micropenis in children's. I have not seen this type of cases, but if this is a case is in front of you, Dr. Yadav, then do take the whole case, because you have to understand why did the body react and the patient got micropenis. So it's a constitutional prescription given the totality. Yes, doctor, thank you so much. How to remember medicine, sir? Remember medicine, just one thing I would like to tell you, that keep reading every day. Don't mug up. Keep reading one remedy every day. Keep repetizing your case, one case every day. Go home and give time to yourself, at least 1 hour every day. One case which you have, if you feel that you have not repetized properly, you have not prescribed the medicine properly, go home and read those cases. Read Mater Medica every day, one remedy. Whichever book you like. It is not that if I am reading Allen's Keynote, you also read Allen's Keynote. Whichever book you like, whichever books that suits you. For example, we have books like Allen's Keynote, Clark, Herring. Every book is good. Every book has those common symptoms. Follow the masters. Everyday reading is very important. That's the only thing which will make you realize the value of symptom. Because see, every time you are basically understand the concept mentally, I'll tell you that one patient basically is having a problem of esteem, and because of esteem there is a lot of problem in the XYZ. So if you understand remedies through concept of mind, it is a very hairline difference, and you can make a mistake. But if you don't want to make a mistake, study the remedy in what you call local symptoms also, so that you can differentiate easily. First go basically those wise, and then you can automatically develop your concept of a remedy, and that will help you in identifying and differentiating cases. And okay, thank you. How to remember medicines? Do you have remedies for? Yes, we do have remedies for hernia, and in fact, I have got good results in cases of hernia of inguinal hernia, where I have been able to cure a lot of cases of hernia. Is it possible to ask the question about profound weakness after COVID, walking upstairs, especially taxing exertion is dying? There's a question on WhatsApp. So the remedy in this case, you can say malignant weakness. You have to think about 3 remedies, very, very important. First is muriatic acid, second is arsenic album, third is LCMM, and the fourth is China. Think of China ars also. 5 remedies. Is there any medicine for ovarian tube blockage? Yes, definitely we have remedies for ovarian tube blockage, and the patient will come to you for infertility where the hole that tubes are blocked, and he'll come to you because allopathy medicines have not worked in those cases. We have a fantastic cures, we have fantastic results in those cases. Just take the whole case, but still if you don't understand the case, again I tell you 2-3 remedies that you have to think before you get a simulimum. Thiocyanaminium in LM potency, think about that. Second, calcarea fluor in LM potency, think about that in cases where you find that you're not getting the remedy. Now, Dr. Sachdeva asked me remedy for hernia. If there is congenital hernia, Dr. Sachdeva, if there is congenital hernia and you have not got any remedies, you are confused what to give, then do give Thuja. I have seen congenital hernia, Thuja works very well. Do give Thuja if you feel that you have not got the case properly. In infantile hernia, 2 remedies are very, very important that I have found useful. First is aurum metallicum. Second is Nux vomica. Of course, if there is trauma, if there is fall, and then the patient starts getting hernia, do think about Bellispur and then Ruta graveolens. In general cases where the hernia is very tender and very sometimes painful, not strangulated, then think about Cilicia. And of course, some generalized remedy for hernia. There are a lot of remedies you can think about: Lycopodium, Lachesis, Pulsatilla, Staphylococcus aureus, Zincum metallicum also. So this is how you differentiate hernia. One more remedy, one more question on WhatsApp: muriatic acid, Gelsemium, China ars, and arsenic album. I hope that is taken care of. Please mention the remedy for hernia. I told you the remedy for hernia, no? Infantile hernia, congenital hernia, tender hernia, and general hernia, I have told you. So this is very, very interesting. There are remedies where for umbilical hernia, which I found very useful. The remedies are Calcarea carp, Plumbum metallicum. Works fantastically if the hernia is umbilical hernia. I have got good results in those cases. Dr. Das, I have fistula for 2 years, spinal abscess in forming of regular basis at least 25 times in last 25 years. Fistula for 2 years, abscess is forming on regular basis at least 25. Okay. Now see what happens, Dr. Das, that if you are suffering from fistula and you have tendency to get what you call recurrent boils. Of course, I will not tell you what to do. First of all, give that local symptom, define that local symptom, very important. Second, if you are not able to get, and because you are finding it difficult because abscess forming, my dear doctor, start calendula and LM potency. Start calendula and LM potency and you will get very good results. Remedies for this recurrent could be also Staphylococcus. Streptococcus also will be indicated in these cases, but calendula I have found it very good in these type of cases. So my dear friends, I hope I am able to answer some of your queries. I tried to answer many of questions. And there's one more question. Okay, there are few questions. I think some have not been able to join properly. Okay, I'll answer those questions in next YouTube, but today I think this is sufficient, and it was nice talking to you. I also missed you on the last YouTube because I could not connect, and I hope to meet you on next YouTube live. Of course, planning for some more beautiful sessions in the coming future. Thank you for joining and thank you for your valuable time. Thank you so much.